We have a number of people here to talk today, and I want to thank them for doing that. Sally, why don't you come on up? Sally Miller is going to read some letters from people here in the Lansing area who have suffered because of lack of health care. Let's give Sally a round of applause.
Okay.
Amy Buttery is also going to read one.
Okay. Can you hear me all right? This is a letter from Donna in Lansing. My brother-in-law has prostate cancer and no health insurance. He has been denied coverage due to type 2 diabetes. The surgery is scheduled and prepayment of $36,000 is required 10 days prior to surgery. They do not have $36,000. While preparing for the prostate surgery, he was required to have a stress test, and that reflected abnormalities, so he had a heart catheterization, and payment was required in advance because he has no insurance. Due to blockage found during the catheterization, he had a quadruple bypass the following day and has since had to have aspiration of fluid from the lungs. Again, no insurance. My sister has contacted all of the providers to arrange for monthly payment of fees. One hospital said the amount had to be paid within 1 year or they would refuse to provide any future care. The prostate surgery has been rescheduled. However, payment is still required 10 days prior to the procedure. There is no assistance available because of the annual income. But the income is very limited and the family is pooling monies to prepay the impending surgery. There is naturally stress because of the medical condition, but there is even more stress because they have no insurance and not enough funds to cover all the charges.
I have a story to read as well, but what that story there reminded me of, something you may already know, is how many bankruptcies in this state are due to medical bills that can't be paid. And these are people with insurance. And then there's the group that don't have insurance, and all of these people are looking at, a ruination of their financial status as a result of just wanting medical care. This piece that I have is from Erica in Lansing, and just the struggle to get health insurance for her family. I first learned how absolutely ridiculous individual health care is in this country when I left my secure public teaching position to take care of my newborn. We had to purchase individual health care, and I did a lot of research, a lot. We were moving out of state, so COBRA was basically out of the question. Our costs would have been $1,200 a month, and we would have had to still pay 60% of the costs because we were out of network. That is not health coverage. So I had to look into individual coverage for our family. In the meantime, we were looking for any job for my husband that included affordable health care. We were not going to go one day without coverage because we had a newborn, and it's just too important. The best deal I could find covered our whole family, but not if I got pregnant again, for $540 a month. Here's the catch. We still would have to cover 30% of our costs for visits that were not preventative. We were only allowed 2 visits per year for that $540 a month. And we were only allowed, and with a newborn child, I had to decide when she was sick enough to go to the doctor. Even paying $540 monthly, this was my coverage, or lack of it really. So I thought preventative care is mostly all we need, and we're covered up to $500 yearly. I took my daughter for her 6-month well child checkup and immunizations, and the bill came to about $475. There goes her preventative coverage for the year. This is a newborn. I mean, this is a child in her first year of life. I should go back for a 9-month well child and a 12-month well child and a 15-month well child. I was finding that I was not covered at all. I was just giving the insurance company money and still paying to go to the doctor. It was the most frustrating experience, and I felt helpless. My husband eventually found a job that he took purely for the health benefits. He hates it. But until we can find something better, or I can find a job in Michigan that offers coverage, which has been virtually impossible, we have to stick with it. That is why I support health care reform, and I expect real reform. I want to be able to buy into coverage that really covers and is similar to what senators have. In addition to my story, I come from a family of 5, 2 brothers and 2 sisters. 4 of us have college degrees. Only 1 of us has health coverage. All of us have full-time jobs. It is very telling that 20% of a middle-class family, all in our 20s and 30s, has health coverage. There's got to be change.
Thank you.